Hi, I'm Mia. I'm going to be your nurse practitioner today. I'm just washing my hands. Okay, so today we're going to start with abdominal assessment, and then we're going to look at the range of motion of all of your big joints, and kind of looking at your memory and your balance, and test your cranial nerves as well. Okay?
Okay.
All right. So with my freshly washed hands, I'm going to pull up your shirt to inspect your abdomen. Okay. And my patient is 14 weeks pregnant, so as expected, has a slightly protuberant abdomen. And it is symmetrical. I don't see any erythema or swelling. Do you have any tenderness in your abdomen?
No.
Okay, and no visible pulsations. All right, and then I'm going to auscultate. I have the stethoscope that you press lightly for the bell and a little bit more deeply for the diaphragm. All right. Listening with the diaphragm, I've got vowel sounds in all four quadrants. Okay. I'm going to listen to the femorals. Okay, and then I'm going to assess the renal arteries with the bell. And the aortic. And the iliac. And no breweries auscultated in any of those areas. Okay. Now I'm going to percuss. Sorry about my cold hands. Hopefully you can see what I'm doing. So far, timpani. I'm getting a little bit of dullness with the bladder, just above the suprapubic, in the suprapubic region. All right, and now I'm going to percuss her liver, starting at the mid-axillary line, just above her umbilicus. All right, and I feel dullness starting there, underneath the costal margin. All right, and then I'm going to go central here at the mid-sternal. Okay. Also, I'm going to do the scratch test. And I can hear the scratch get louder and just more audible, I guess, as I move off of the liver. And I measured her earlier, but I will measure her again. And it's mid-axillary, right underneath the breast. The liver's 6 centimeters, and it was just under 4 at the mid-sternal, which is within normal limits for the size of the liver. And then I'm going to palpate the femorals. Okay, 2+. And then I would palpate the inguinal nodes, but I'm going to respect her privacy. I'm not going to go completely deep into the nodes. Also, I'm going to gently palpate for the kidney. And this will be the right kidney. I'm just kind of lifting. And it's a little hard, and I don't want to, push too hard since she's pregnant, but normally I would kind of cup with one hand and kind of press down on the abdomen and try and get the kidney kind of between my fingers of both hands. Okay. And then I'm going to have you roll on to the side facing me. And I'm going to palpate here and feel the spleen. Any tenderness?
Nope.
Okay. I'm going to percuss starting about the 6th rib. And it feels pretty tympanic over here with no tenderness. Okay, roll back over to your back for me. And I'm going to just kind of lightly palpate the rest of the abdomen. And then I would normally follow it with a deep palpation, but being as she's pregnant and probably has a fairly full bladder, I'm going to spare her too deep of palpation. A little bit of remnants of an umbilical hernia that's not really actively herniated, just non-palpable anyway. And I can feel where the bladder line is there. It's a little bit more taut. Okay. So then I would go around again with the deep palpation. Right, so I'm going to lift your leg up. I'm going to feel about the joint to just feel if there's any tightening, tension, or crepitus, or pain, or anything like that. The legs, her legs are even muscular tone, even skin tone, symmetry of size, no atrophy of the musculature that I can see, no swelling, no tenderness, all that good stuff. All right, so I'm going to rotate out, back in now. Yep. Now push against my hand, push against my hand, push against my hand, push against my hand. Okay, and go ahead and extend your knee joint. There you go. And push against my hand. With like try and bend your knee. There you go. And push up. There you go. Okay. All right, go ahead and put it down. And I'm just going to feel here for any tenderness, asymmetry of ligament. And I kind of push on her patella and see if I have any fluid out the other side. I don't feel anything. Do the same over here. No tenderness?
Nope.
No crepitus. All right, now we're going to do range of motion of the other hip. Okay, and then put out. Okay, and push out against my hand. Okay, push in against my hand. Push down. And pull up against my hand. All right, and then I'm going to straighten your knee, bend your knee, and push down. Okay, push up. All right, and you can go ahead and put down. And I'm just kind of feeling for any movement that might be too much in the knees there. And there's a little bit of lateral movement, but within normal limits and no tenderness. Okay. I'm going to take off your socks. Okay. Okay, I've got glovies. Like I'm in mid-range of motion after bending on this hardwood floor. You can feel my crepitus later. All right. Okay, and just kind of move your ankles, move your foot up and down and kind of wiggle your ankle around. Okay, same with the other one. Okay, good. And I'm going to just relax your leg. I'm feeling the Achilles, and then I'm going to feel the heel for any bone spurs, any like tightening, tenderness. They both feel even, no tenderness.
Nope.
Okay, don't feel any spurs. Okay. All right, and then press on me like a gas pedal, and then push up. Okay, and then kind of invert your feet and keep your knees straight. Just there you go. And then the other way. Good. All right, and then toes, and then push your toes against me and away. Okay. And I'm just inspecting the musculature of her feet. I don't see any atrophied muscles. Low arches, symmetrical. No plantar fasciitis, plantar warts or anything like that on the skin. The joints feel normal size. Okay. Any tenderness?
Nope.
Okay. And now I'm just going to feel and kind of move your toes, okay? can feel your joints. So I'm feeling all the joints and the toes laterally, as well as the proximal distal. There we go. The same thing here. They all fell within normal limits and are non-tender. Alright. No edema in the feet, no edema around the ankles, no pretibial edema, no lower limb edema. We'll reassess that in a couple months, close to the end of this pregnancy. But everything looks good, and the strength is good, equal. Very good resistance against me in all areas, all range of motion. Hands washed again, since I went to take care of the camera. Alright, so now I'm going to look at the range of motion of your upper extremities. So if you could just do your chin to chest and up, side to side. Okay, good. And then I'm going to have you kind of move out your arms and reach above your head, kind of down in front of you. Okay. And then I'm going to have you kind of put your hands above your head that way, and then down and behind your back. Okay. And I've kind of inspected and palpated, asked her about tenderness earlier, if she had any areas of tenderness. And I see symmetry. Go ahead and move your arms out. Okay, and down. Okay. And there was no crepitus or anything like that. Okay. And then I feel the elbows, the lateral and medial epicondyles. Okay. And the olecranon process. Any tenderness?
Nope.
No asymmetry, no. It feels good. Alright, so then elbows out, and then in, and out again, and then palms down, palms up. Okay, great. Alrighty. And then put your hands out like this, wrist down, and up, and kind of side to side. There you go. And then make a fist, and then spread your fingers as much as you can. Alright, and now I'm going to try and push your fingers together, and don't let me. Okay. Good, and equal strength bilaterally. Okay, grab my fingers really hard. Good, equal strength. Give her a 5 bilaterally. I'm also going to feel her fingernails, since sometimes you can't see pitting, but you can feel it. And I don't feel pitting, and everything looks good. And now I'm just going to feel the joints in your hand. I noticed a small, about 1.5 centimeter by 1.5 centimeter cyst on her left wrist. Any tenderness with that?
Nope.
Nope. Okay. I'm just going to move your thumb back and forth. Relax, okay? No tenderness?
Nope.
And I'm going to feel the joints. All along, down each finger. So far, no crepitus, no visual or tactile asymmetry, no tenderness. Okay. A little bit of eczema noted on the right hand, about a 3 centimeter by 4 centimeter patch she gets from wearing the gloves at work. I'm also, every time I'm observing, I'm looking at color, edema, symmetry, hair distribution, all that good stuff. Okay, and I'll do the range of motion of this guy. Let me move it. Here you go. Okay, seems good. Okay, now I'm going to do a little bit of cranial nerve testing, since we're going to jump a little bit out of, well, actually I'm going to feel your spine first and take a look at your spine. And then we're going to do some cranial nerve testing, okay, so that we can keep the camera angle. So you can stay there. I'm going to feel along her spine. Any tenderness?
Nope.
Alright, and I feel the lateral muscles along her spine. One is a little bit larger than the other, but very minimally. And they're strong with tenderness. And no kyphosis in the upper back, and no lordosis in the lower back, but we'll check again when you stand later on. And go ahead and push your shoulders up against me, okay? And then your head against my hand. Okay, and I can see the SCM muscles engaged against resistance, strong, equal bilaterally. And then I'm going to have you go ahead and close your eyes for me and tell me what you smell.
Alcohol.
Yep, very good. Okay, you can open your eyes. And then I'm going to have, looking at me, just with your eyes, follow my pen. Ocular muscles intact. One little bout of nystagmus at the left lateral, but that's normal. Go ahead and cover the, like match me, cover your eye. Alright, and then tell me when you see my fingers.
Yeah, I see them.
Okay.
You see them. I see them.
Okay.
See them.
Okay, and then tell me when you can see the number of fingers I'm holding up.
2.
Okay.
3.
Okay.
1.
Okay, other eye. Do the same thing. Tell me when you see my fingers.
Feel them.
Look at me.
See them. I see them.
Smile is symmetrical. Okay. And number.
2.
Okay.
3. 1.
Good. Okay. Concentration is good. Your peripheral vision's a little bit better than mine. Alright, and close your eyes real tight for me. Okay, don't let me open them. Alright, good. And then smile. Puff out your cheeks. Okay, good. And now I'm going to test sensation. Alright. So this will be soft. Or dull, rather, sorry, dull, soft, and sharp.
Okay.
Okay, so close your eyes and tell me what you feel.
Soft. Dull. Sharp. Soft. 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 Sharp. Soft. Dull. Sharp. Sharp. Soft. Dull.
Okay. I'm going to do it, make sure I get all the feel to your face. Which one's that?
Soft.
Okay.
Dull.
Try
Sharp.
not to poke you too hard since it's a pen.
Sharp.
She said I could use the pen. It's not marking, which is good.
Sharp. Soft.
Okay, very good. Alright, and still with your eyes closed, I want you to hold out one hand and tell me if you can identify that object in your hand.
It's a key.
Okay, stereognosis in the left hand is accurate. And what object?
It's money. It's a coin.
Yep, good. Okay, very good. Let's see. I would also have her normally like open her mouth, and I would have her say "ah" and watch the soft palate rise and watch the uvula rise midline, and the gag reflex. All to look at vagal and hypoglossal, have you swallow, palpate the pharynx and the larynx for all that. And then I would also, I don't have a tuning fork, so I'll pretend this is my tuning fork. I would, activate my tuning fork, and for the Weber test, do the right on top of her head and see if she heard the sound equally in both ears or if it went laterally to one or the other. And then for the Rhine test, I would also do the tuning fork, hold it on the mastoid process, ask her to tell me when she stopped hearing the noise, and then hold it just a few inches out laterally from her ear and see if she could still hear the noise. I would do it on the other side. And then when she stopped hearing it, see if she could still hear it here, and see if it, times correlated and if it seemed fairly, about the same. So we did the facial nerve with the sensory motor of the face, cranial 5, cranial 7, with the sensation and puffing out your cheeks and closing your eyes, and everything is intact. And let's see, I'm trying to see if there's anything else I can do with her sitting down. And can you clench your jaw and move it side to side? Yeah. And I'm going to feel the temporal mass and muscles there. Okay, open and close. Okay, a little bit of crepitus there, a little bit of TMJ. And raise your eyebrows for me. Okay, good. I can't say spit out your tongue. Stick out your tongue. Someone else needs a neuro assessment. And then side to side. Okay, good. All right. And can you tell me your date of birth?
September 30th.
Okay. Yeah, what would make the years now? Can you tell me what month it is now?
April 1st.
And can you tell me what you did yesterday?
A lot of traveling and I ate a whole lot.
Okay. And then who was since we were in class together, I can ask her kind of a remote memory question that I know the answer to. Who was our first assessment teacher for our initial assessment class for nursing?
Dr. Brown.
Okay, good. And I'm going to ask you 3 words later on that I will hopefully be able to remember. Car, key, and ball.
Car, key, ball.
Okay. And I'm also going to do a whisper test. So I'm going to kind of step behind you. I'm going to whisper a word, and I want you to tell me what it is. Basketball.
Basketball.
Okay, and I'm going to do the other side. Baseball.
Baseball.
Okay, very good. Alrighty. And let's see. Can you tell me what don't count your chickens before they hatch means?
Don't put all your eggs in one. Just basically don't count on something before it happens.
Okay, good. And can you spell the word world backwards?
DLROW.
Okay, and can you count down just a little bit by sevens from 100?
197, 86, 79.
Close. Okay, that's difficult. Just move your hands back and forth as fast as you can. Okay, good. All right. And I've been listening to, her articulate her words and stuff like that as we've gone through our conversation, and responding to commands and everything like that. Very strong. Now I want you to, with your finger, touch your nose and then touch my finger, and then keep doing it. Okay. Now switch hands and do the same thing. Okay. Good. Good coordination. Alrighty. And then put your hands on my hands. And I'm just kind of assessing for a resting tremor, which I do not feel any. And then go ahead and grab this object out of my hand. Alright, and no intention tremors. Noted. Okay. And I think we could probably do some of our reflexes within this camera view. Hopefully. So I have you rest your arm, and I don't have a real reflex hammer, so, but we would look for some, this is the bicep, so we'd be looking for some bicep flexion, and I would then go to the other one, relax your arm. I mean, I'd hit harder than that, but, okay, and then I'm going to do down here. And I got a little bit of flexion out of that hand. Just relax. I got a little flexion out of that hand. Okay. And then I'm going to just go ahead and kind of be limp as you can. And do your tricep. And I can kind of feel a little bit of contraction, but not a ton. A real reflex hand would be good. Relax. A little bit of contraction. Good. Okay. And I'm going to just, since our table is not long enough to let her dangle, I'm going to just kind of go ahead and dangle. And feel for the patellar ligament here. A little bit of movement. Relax your leg. A little bit of movement. Get your feet. Okay, let's see. Okay, and then I'm just going to look for the Achilles there, and got a little dorsiflexion there, plantar flexion, the appropriate flexion. Okay. And all right, go ahead and close your eyes and tell me, okay, this is up, this is down. Tell me if it's up or down, okay?
Okay. Down. No. Down. Down. Up.
Okay, good. And one other thing I would have done earlier is that I don't think I mentioned is that I would kind of do a deep palpation to feel for the liver edge and have her inhale to see if I could feel that border. But being as that she's pregnant, I didn't want to go digging, even though it's pretty far away from the uterus. Just was trying to be polite. Anyway. Alright, so we will, I have to do the Babinski, I'm really sorry. She's very ticklish. Alright, just try and relax. Okay, and the toes curled down as best they could in our situation. So I am now the videotaper and the examiner. If you could stand up for me and just kind of twist from side to side. Okay, and then kind of bend from side to side. Good. And that's even. Alright, and then kind of face away, or actually face the wall there. And go ahead and bend and touch your toes. And she doesn't reach her toes, so I was going to use that I will use that measuring tape to measure the distance from her middle finger to the ground, just from my baseline. I'm going to palpate up her spine again. And there's even symmetry in the shoulders. And the muscles lateral. Feel much more even toned actually with bending over than earlier. And the spine's nice and even. Okay, and go ahead and stand up. And I'm going to actually move that out of your way. I don't want you to trip on it. Alright, and then if you could walk on your heels that direction. Great. And then walk on your toes on the way back. Okay, good. Alright, excellent. And just because I think I wasn't exactly clear because I was worried about the videotape, we tested the cranial nerves. 1 was the alcohol swab for her sense of smell. Cranial nerve 2 was the confrontation, covering one eye and me matching. 3, 4, and 6 were, all the different muscles of the eyes that move them up, down, side to side, and at the angles. She clenched her jaw, she moved it side to side. I palpated her masseter and temporal muscles. I also touched different parts of her face for cranial nerve 5. And she raised her eyebrows, closed her eyes tight, puffed her cheeks out for cranial nerve 7. We did the Ryan and Weber test and the whisper test for cranial nerve 8. 9 and 10 were glossopharyngeal in vagus, where I palpated her pharynx, larynx, looked at her uvula, soft palate, and theoretically her gag reflex. 11, spinal accessory with moving the head against resistance and the shoulders. looking for the SCM muscle to contract, and 12, hypoglossal, her sticking her tongue out and moving it side to side. And thank you very much for tuning in. One last thing is the Romberg, which I will have to kind of get creative here. Feet close together. Yeah, don't fall. Okay, and eyes closed. And for 30 seconds, and ideally I'd have both arms to catch her if she were unstable. But you're very stable. So we'll cut it short, and you are free to get dressed, and we'll go eat lunch.